Prednisone is a powerful medicine that has helped millions of people. Some call it a miracle because it can quickly reduce pain, swelling, and allergic reactions. But others warn that it can also bring serious health problems if not used carefully. So, prednisone is a powerful medicine that has helped millions of people. Some call it a miracle because it can quickly reduce pain, swelling, and allergic reactions. But others warn that it can also bring serious health problems if not used carefully. So, is prednisone truly a miracle, or is it a hidden danger? In this video, we will explore both sides, the benefits that make it life-saving and the risks that every patient should know. Prednisone is a type of medicine called a corticosteroid. It works by copying the effects of cortisol, a natural hormone made by our body. Doctors prescribe it to reduce inflammation and calm down the immune system. This makes it very useful in many conditions, such as asthma, arthritis, severe allergies, skin problems, and autoimmune diseases. In simple words, prednisone helps when the body's immune system becomes too active and starts causing harm instead of protection. Prednisone is often called a miracle because of how quickly it works. When someone has severe swelling, pain, or an allergic reaction, this medicine can bring relief within hours. It calms the immune system and reduces inflammation almost immediately. For a patient struggling to breathe because of asthma or someone experiencing a dangerous allergic reaction, prednisone can be life-saving. Doctors also use it in conditions like rheumatoid arthritis, lupus, or skin rashes that are not responding to other treatments. Without it, many people would continue to suffer from pain, stiffness, or breathing problems. Prednisone makes it possible for them to live a more normal life. In hospitals, it is used in emergencies to save lives. This is why doctors trust it in critical situations. But while its quick action feels like a miracle, it comes with a price. The same strength that makes prednisone effective can also lead to uncomfortable and dangerous effects, especially if taken for too long. This is why it is important to understand both sides of this powerful drug, what it can do for you and what harm it can cause if used carelessly. Prednisone acts fast, and while this is a benefit, it also brings some quick side effects. These usually appear within days of starting the medicine. Many people notice trouble sleeping, also called insomnia. Others feel unusually hungry and begin to eat more than normal. Mood swings are also common. Patients may feel anxious, restless, or even unusually happy or sad without reason. Another noticeable change is swelling in the face, often called the moon face. This happens because prednisone makes the body retain fluid. These effects are uncomfortable, but in most cases, they are temporary. Once the dose is lowered or the medicine is stopped, the symptoms usually fade away. Still, they can be difficult to manage, especially for people who need the medicine for several weeks. Doctors often warn patients about these early signs so they do not become alarmed. While short-term side effects are not usually dangerous, they are the first signal that prednisone is a strong medicine. They remind us that it is not harmless, and even though it can bring quick relief, it should always be taken under a doctor's close supervision. One of the biggest dangers of long-term prednisone use is its effect on bones. Prednisone weakens the bones by slowing down the cells that build bone and increasing the activity of those that break it down. Over time, this imbalance leads to osteoporosis, a condition where bones become fragile and brittle. Patients may not feel any symptoms at first, but after months or years, the bones can become so weak that they fracture easily, even with small falls or minor pressure. Hip, spine, and wrist fractures are especially common. This risk is even higher in older adults and women after menopause. Doctors often recommend calcium and vitamin D supplements for patients on prednisone, along with weight-bearing exercises to keep bones stronger. But even with these measures, the danger of bone loss remains. This is why long-term treatment requires regular bone health checkups, such as bone density scans. Osteoporosis caused by prednisone can be permanent and very hard to reverse. For many patients, the fear of broken bones and reduced mobility becomes a lifelong concern. That is why bone health is one of the most serious long-term risks of this medicine. Another hidden danger of long-term prednisone use is its effect on the eyes. Patients who stay on this medicine for months or years often develop cataracts, which make the lens of the eye cloudy. Cataracts cause blurred vision, sensitivity to light, and eventually serious vision loss if not treated. In some cases, surgery is needed to restore vision. Prednisone can also increase the pressure inside the eye, leading to glaucoma. Glaucoma is especially dangerous because it damages the optic nerve and can cause permanent blindness. What makes this worse is that glaucoma often develops slowly and without symptoms until the damage is advanced. Because of these risks, patients on long-term prednisone need regular eye exams. Doctors may check eye pressure and monitor for signs of cataracts early, before they cause major problems. The connection between prednisone and eye disease is strong, and studies show that the longer the treatment, the higher the risk. For patients who already have eye problems, such as diabetes-related eye disease, prednisone adds an extra burden. This makes careful monitoring essential. Without regular checks, the damage to the eyes can be permanent and life-changing. Prednisone also has a major effect on metabolism. Many patients notice weight gain within the first few weeks of taking it. This happens because the drug increases appetite and makes the body store fat differently. Most of the fat is stored around the face, neck, and abdomen, giving a round, moon face, and a heavier midsection. Along with this, prednisone raises blood sugar levels. For people with diabetes, it becomes much harder to keep blood sugar under control. In some cases, patients who never had diabetes before may develop the condition because of prednisone. This is called steroid-induced diabetes. The rise in blood sugar can also make patients feel thirsty, tired, and prone to infections. Doctors usually monitor glucose levels closely during treatment, especially for patients on higher doses. Lifestyle changes, like eating healthy and staying active, can help, but the medicine still makes it difficult to maintain normal metabolism. These changes can affect self-esteem, daily life, and long-term health. This is why metabolic side effects are considered one of the most frustrating and harmful effects of long-term prednisone use. Prednisone mimics cortisol, which is a hormone naturally produced by the adrenal glands. When someone takes prednisone for a long time, the body senses that there is already enough cortisol, so the adrenal glands stop making it. This is called adrenal suppression. The danger comes when the patient suddenly stops taking prednisone. Since the adrenal glands have become lazy, the body is left with almost no cortisol at all. Cortisol is essential for survival, as it helps the body manage stress, maintain blood pressure, and regulate energy. Without it, patients can go into adrenal crisis, which is a life-threatening emergency. Symptoms include severe weakness, low blood pressure, dizziness, and even shock. This is why doctors always recommend tapering off prednisone slowly, reducing the dose step by step, so the adrenal glands have time to recover and start making cortisol again. This process can take weeks or even months, depending on how long the patient has been on the medicine. Adrenal suppression is one of the most dangerous risks of prednisone, and it shows why patients should never stop taking it without medical advice. Prednisone can also have a serious impact on mental health. Many patients experience mood swings, ranging from irritability to depression or anxiety. Some feel unusually energetic, almost like a mild mania, while others struggle with sadness and hopelessness. In higher doses, prednisone can even cause confusion, hallucinations, or disorganized thinking. Long-term use has been linked to memory problems and a condition sometimes called steroid dementia syndrome. This includes difficulties with concentration, focus, and clear thinking. These changes can be extremely distressing for patients and their families. Mental health effects are unpredictable, as some patients experience them strongly, while others hardly notice. What makes them dangerous is that they can appear suddenly, even in people with no previous mental health issues. Doctors usually warn patients to report any major mood or behavior changes quickly. Sometimes, adjusting the dose or adding supportive treatments can help. But in many cases, these effects only go away after stopping the medicine. The mind is as important as the body, and prednisone's impact on mental health is one of its most concerning long-term side effects. Prednisone also takes a toll on the skin and muscles over time. Patients often notice that their skin becomes thinner and more fragile. Even a small scratch or bump can cause large bruises. Wounds also heal more slowly, which increases the risk of infections. Stretch marks may appear on the stomach, thighs, or arms. Along with this, muscles become weaker. Patients may struggle to climb stairs, lift objects, or even perform daily tasks they once found easy. This weakness is due to the breakdown of muscle tissue, which happens when the body is exposed to steroids for too long. These changes affect both appearance and physical ability. For many patients, the visible effects on skin and body shape are emotionally difficult to cope with. Combined with weight gain and swelling, these side effects can reduce confidence and quality of life. Doctors sometimes recommend exercise and a healthy diet to slow down these effects, but they cannot prevent them completely. Skin and muscle problems are another reminder that long-term prednisone use changes the body in deep and lasting ways. The real danger comes when prednisone is taken for months or years. Long-term use weakens the bones, leading to osteoporosis and fractures. Even small falls can break bones. It can also harm the eyes, causing cataracts or glaucoma, both of which can lead to vision loss. Prednisone changes metabolism, leading to weight gain, fat around the face and belly, and high blood sugar. This can even cause diabetes. Another risk is adrenal suppression. Since prednisone copies cortisol, the body's natural hormone, the adrenal glands stop making it. If the drug is suddenly stopped, the body can go into adrenal crisis, which is life-threatening. Prednisone also affects the mind. Mood swings, anxiety, memory problems, and even confusion are possible. The skin becomes thinner, bruises easily, and heals slowly. Muscles weaken, making daily activities harder. These side effects build up over time and can change a person's life. This is why doctors always try to limit how long prednisone is used. There are times when prednisone is not just helpful but essential. In severe asthma attacks, it can open the airways and save a patient from suffocation. In strong allergic reactions, it can calm the body before the reaction becomes life-threatening. In autoimmune diseases like lupus, rheumatoid arthritis, or multiple sclerosis, prednisone controls inflammation when other medicines fail. Doctors also use it to prevent organ rejection after transplants. In all these cases, prednisone is a powerful tool that can mean the difference between life and death. But because of its risks, doctors usually plan for it to be temporary, or they combine it with other treatments to reduce long-term damage. Prednisone is truly a double-edged sword. On one hand, it can save lives and bring fast relief. On the other hand, it can cause serious harm if used for too long or without care. The key is balance, using it only when necessary, at the right dose, and for the right duration. If you or someone you know is taking prednisone, remember, never stop it suddenly, and always follow your doctor's advice. This medicine can be a lifesaver, but it is not risk-free. Respecting both its power and its danger is the best way to stay safe. This video is for education only, not medical advice. Always consult your doctor before starting or stopping any medicine. If you found this helpful, please like, share, and subscribe for more simple health explanations. Together, let's spread awareness and stay safe.